Dr. Wagner, we're talking about sleep apnea today. What are the fixes for sleep apnea? Obviously, it could be potentially fatal if it's not taken care of. But what do we do to fix it?
Yeah, you're right. It's definitely sleep apnea puts us at an increased risk for some troubling things, heart attack, stroke, and as we stop breathing at night, continually not knowing, that's the whole problem that we're trying to fix. What are the solutions? The solutions are, first, we would get a home sleep test. That's a test we take home. It'll give us all the information we need in conjunction with your physician to get a diagnosis.
Okay.
The next step is usually we would try and do, or not we, in conjunction with your physician, you would get we call a CPAP machine. That's a machine that's going to kind of essentially breathe for you. It's pushing air, opening your airway so that you can actually breathe at night. Okay. Now, that sounds good. Most people just don't tolerate that. As you can imagine, that can be kind of cumbersome. It can be not the most pleasant thing to sleep with. But for those people who it is that way, it doesn't work for them, we have an option, and it's an oral appliance that you wear at night to kind of position your lower jaw forward and help open that airway. The goal of that is to keep that airway open while you sleep, so that you can breathe.
Okay. So perhaps working in conjunction with the doctor, you might end up with a CPAP. And I know in the olden days, those CPAP things were humongous. It was like being hooked up to an iron lung, I think, and quite noisy. Nowadays, they're not.
No, I mean, CPAPs nowadays are pretty nice. They're quiet, and they can help if the people that are wearing them can tolerate them. Everyone's different, so some people can't tolerate them. We don't want the sleep apnea to be left untreated.
Right.
So one reason why us as a dentist get involved is because there is another option, okay, and that's that oral appliance that can open the airway.
And how does that work? Do you have to have it specially molded to your own mouth?
Yep, it would be like making a night guard. It's kind of similar to a night guard, other than the positioning aspect of it that moves your lower jaw forward. Okay. So we would take some impressions, right, send it off to a lab, and then try it and make sure everything fits just right.
Okay. Are they typically expensive? Does insurance cover these?
Insurance might cover it, especially if we can work with the insurance, but it's all up to your insurance.
I mean, if you establish that it's absolutely a medical necessity for you, then I'm sure they would.
Yep, sometimes we can.
Yeah. And obviously, if you're in danger of dying, it might be something of a medical necessity. That's right. How do we get in contact with you? Really, just to get a consultation first, sure, isn't it?
Our number is 435-753-5166. We're located just kind of across from the Cache Valley Mall on 14th North.
Okay. All right, Aspen Dental, thank you very much, Dr. Wagner. If you do have these problems, please give them a call, and they would be delighted to help you, right?
Yep, thank you.
Thank you.